Sabrina Salas, Matt Tanani, myself, Victorious. Good morning.
Hafa day, everybody. Good morning. As we mentioned earlier at the top of the show, the COVID-19 vaccination clinics ramp back up by the Department of Public Health today, tomorrow, and Wednesday over at Ukudu High School. And joining us live now from the Dededo campus is our Adriana Cotero. Good morning, Adriana.
Good morning, everyone. Yes, I am here at Ukudu High School where we're seeing actually quite a bit of foot traffic as I've gotten here got here around 9:30, and they're seeing a lot of people. And I've also, a lot of them in Amco have tons of questions too, is what I've realized just standing here, watching them come in. They're asking a lot of questions. And to help answer those questions is Margarita Gay. She is one of the lead nurses, wears lots of hats with public health. And she's someone we saw at a lot of the different mass testing sites. I know I always would find her when I'd go there, and she was always so willing to talk. So I found her again here at Okudu at the vaccine clinic. So Margarita, if you could just tell us a little bit about making the transition from, mass testing to now here at the vaccine clinic, what it's been like for you and what you're noticing.
Well, in this mass vaccination, it's a bigger setup because it deals with different phases of getting a vaccine. And so we have 5 stations that this is the first that we assess them. This time we check your name if you're registered, and then we go in and we do the assessment. There's a doctor present, and then they get immunized. But a lot of questions with the seniors is starting from this line. And so with this tier group, we expected more issues to come up because they're more concerned. They have a lot of, they may be on a lot of medication or chronic conditions, and they just want to make sure that they're okay to take this vaccine. Mm-hmm. So they have other, disabilities with them, and then they have also a caretaker or they're part of their family with them to give them that extra support. Mm-hmm. And comfort while they get vaccinated.
That's right. And something else that you and I had just briefly talked about was how a lot of them in AMCO haven't even been out of their house for months and months, and now they're coming out here, and now you really are seeing their nerves settling in and very anxious, as you had mentioned.
Yeah, they are very anxious. They're, while they're in line, they're asking questions about, is there any side effects I need to know? Is my medication okay to take it with them? So they are anxious. It's a different flow of people and issues that we're dealing with the vaccine.
And if you could, can we just go over the different general information or any requirements that Manamco need to know before heading in here today?
Okay, first of all, make sure you're registered at your mayor's office. Bring a picture ID. It doesn't matter if it's a driver's license or your senior citizen card, your ID. If you want to bring a list of your medications, you're most welcome, because in case the doctor has issues or questions for you. And then if you need a wheelchair or some assistance, we're also available to supply you with a wheelchair and extra help with you while you're and through the vaccination process.
Definitely. Okay. And so they have to register with their village mayors, and I think that's something that is being checked off right away when people enter here, right? And then if not, then they get sent away, is what I saw as well.
They recommend you come they'll give you the date to come back, because we're following our procedures and we just want to keep. But I just hope everyone please register before coming down. Yes, because I know we're open for 75 years and older, but the main thing is you need to be registered with your mayor's office.
Yes, registration is a big thing.
Yeah, and not every village is today. So,
do you know which villages are today?
I'm not sure, but I saw
Zonia.
Yeah, some dead. So I'm not sure exactly. Those are the villages. Tomorrow I hear it was tomorrow.
Okay.
Nights and Wednesday, but like I said, they should know. The mayor should know which day you're going to be coming.
Okay. Okay. Hopefully we'll be able to get all those details from Janella in just a bit as well. And then for you personally, what has the journey of COVID been like? I mean, I know that, like I mentioned, we saw you at all the testing sites, and now you're here at the vaccine clinic. This is kind of sort of the finish line, I guess you could say.
Yes, it is. The testing was our way of knowing if we had COVID or we're exposed to COVID, and it was a short flow in and out. But now that the vaccination is our finish line, our goal of our plan to vaccinate all the people of Thomas as much as we can. And as a nurse, this is our signature of, yes, we did give you the vaccine. Yes, we're gonna help protect Guam, and it's one of the ways that we've been waiting for is the vaccine. So we're happy that it's here with us.
Have you been vaccinated yet?
Not yet. Supposed to be today. But my daughter and my coworkers, they did get, and they're doing fine.
You're doing okay?
Yes. Yeah. So there is minor sore in the arm, maybe a slight fever, but altogether there's not much side effects that happen to a lot of people. But it's proving itself. The vaccine is proving itself.
Do you know if it's the Pfizer vaccine or Moderna being administered today?
Right now it's Pfizer.
Still Pfizer, because I believe we received the shipment of the Moderna.
Yeah. And the nurses need to be orientated with the new vaccine. Yeah.
Still need to be oriented.
Yeah, because it might be a different way of diluting it, and so we need to. We're getting that information today.
Oh, and then there'll be a training process.
Yes, correct.
Okay.
Yeah.
Okay, understood. Okay, and today open from 9 to 3 p.m. and then again tomorrow.
Yes, correct.
And is it for 3 days like we saw last time?
Yeah,
okay.
Monday to Wednesday.
Monday
and then
to
we do community Thursday.
community. All right, where's the community? Will you be there at the community testing site?
I think so. Yeah, I think so. If I'm assigned, I usually am. And I think this is
At Teasen.
yeah, but like you said, today I will have the mic.
Yes, I'm hoping I can grab it. Okay, all right. Well, thank you. Anything else you'd like to add, Margarita?
Come down when it's your turn, please, and we'll be very we'll be able to give you your vaccine without any problem. But again, please get the vaccine to protect Guam and to protect everybody else.
Okay, thank you. Thank you, and thank you for all your hard work. Yes, yes.
When I last saw you were doing a story on yourself. I said, "Oh, you got sick."
Yes,
And you were okay.
yes, yes. Okay, thank you.
Yeah, I was thinking of.
Thank you. And that, again, was Margarita Gay. She has been at everywhere, I feel like, with Department of Public Health. She has been at the community mass testings and now here at the vaccine clinic. And as I said, I'm always willing to talk. And as she also had mentioned that when coming down here, it's very important to register with your village mayors. I know I saw a couple sent away because today was not their day, and they were a little disappointed because they did make their way out here and they probably haven't been out in a while, but they'll have to come back in a future date. And then as well, hydrate prior to coming. Make sure you're taking all your medications, and then if you had a vaccine within recently, then do not come and get vaccinated as well.
I know that they're also recommending that, if you have any questions, you should check with your private physician before heading down there. But at the same time, they also have physicians on site, and also
they do. And
right.
and what I also noticed is that a lot of people are coming with caregivers. They have another person by them side, and some of it looks like possibly some nurses might be aiding them along the way as well.
Mm-hmm. And they
enter the vaccine clinic.
And they have wheelchairs. I think that's what Margarita was mentioning.
Yep, and chairs set up right here too for people to sit down.
Mm-hmm.
And then, so we were supposed to have Janella, and I'm hoping I can find her, but she ran inside.
Okay.
There's been a lot. I know that she's been very busy this morning, from what I can tell. Just a lot of questions being asked amongst everyone.
Mm-hmm. All right. Well, thanks a lot, Adriana.
Of course, thank you all.
So again,
We have Janella.
Oh, okay, yeah, because I think there is a lot of questions. Hopefully we can.
Okay, we are live right now. So Janella, hi, good morning. Hi, good morning. Good morning. So we actually had just spoke with Margarita Gay, and she gave us a little bit of the general information for those making their way. But if you could just tell us what villages are today, because we know that Manamco have to register with their village mayors.
Sure. Yeah. So, we opened up the registration to basically all villages who were able to, register with their respective village mayors and submit that list. I know that there were some villages that were not able to submit a list. I think Jigo was not able to submit a list of their Manamku. I think there might have been some villages who told us that they are getting their registration still together and asking their constituents to report tomorrow. I think the village of Tuman, Carmen is doing that for tomorrow. So basically, if you were able to register with your village mayors on or before December 26th at 1 p.m., and as long as your village mayor submitted a list to us, then you should be able to come and report today. Other than, those village mayors who were not able to submit a list. And then if you registered after December 26th at 1 p.m., then it would be for tomorrow. And then if that list was tomorrow, it would be tomorrow or on Wednesday, depending on, what or when your village mayor lets you know, okay, I think we have, you will have to report on Wednesday instead.
Okay. Okay, and then there are doctors on site, right, to monitor the Manamco after the vaccination during the observation period?
Yes. We have Dr. Dabrowski, and we also have Dr. Bobby. So we have doctors at every vaccination.
Okay, and something I noticed, just standing here, is there's a lot more questions being asked from the Manamco. What are some of those questions that you've heard? And I guess because, we're getting them as well on the show right now.
Okay, yeah, so actually initially there was a little bit of some confusion as far as the registration this morning. So, we did have some of our Manamco show up who weren't on the registration list. I think there was some confusion as far as registration was concerned. And I think, that had to do with, perhaps some village mayors were just sending some of their constituents up here without first registering them. So we are trying to iron that out and working with the village mayors just to ensure that they're first getting them registered or clearly communicating that they need to come on the correct date. So those were a lot of the questions that we were getting this morning. And if they weren't on the list this morning, then of course we're trying to first get them on the list, get their name, their contact information, and then asking them to come back either tomorrow or Wednesday. And then once they get inside, we do get some of them who are, of course, expressing some of that initial hesitation, which we also get with just generally, even with some healthcare professionals who have that sort of, fear with getting that shot. A lot of them are afraid of needles, but we always assure them that, just relax and breathe. And then once they get the shot, a lot of them say, you know what, I didn't feel anything because a lot of our vaccinators are pros at this. So, but overall, we actually opened our doors a little early, before 9 o'clock. And the process so far has been pretty smooth. In fact, we kind of changed the way our layout is just to accommodate our Manamco. So instead of having them go straight into Station 2 once they register, we opened up a room to the side where they can actually wait, sit down and wait. That way we can accommodate them because we know that a lot of them are elderly. Some of them are a little bit more frail, so we have a waiting room for them to sit down. That way we can accommodate.
Some of the other questions I think I heard amongst the Manamco were whether or not there'd be any side effects with the medicine that they're already on, or if they should be taking, or if their medication is okay, and also asking about side effect questions, and then whether or not they should get the vaccine if they've had a vaccine recently. Have you heard it? That's just what I kind of heard while I was standing here.
I haven't heard that one, but we do, we did include that in our project release cautioning them that, you know, if they have received a vaccine within the last 14 days, then they cannot get this vaccine, the COVID-19 vaccine. We do have a handout that we give to everybody who comes through our doors, that if they receive any vaccine, whether it's a flu shot or any other vaccine, in the last 14 days, they cannot receive the COVID-19 vaccine. So, and if they have that question, of course, we have people here to answer any questions that they have.
Okay, and then I was asking Margarita a little bit about this, but the Moderna vaccine just came in and she said that there would probably be a training process needed.
Right.
Is that correct?
Right. Yeah. Just like with the Pfizer vaccine, the Moderna vaccine also it's fairly new, of course. So they would also have to be trained as well with that as with the Moderna vaccine as well, because we did just receive it early yesterday morning. And so that was also properly stored. So the nurses would also have to get, acquainted with the procedure. And we're also still waiting for the ACIP recommendations and CDC recommendations for that as well.
Okay, and then there's a VACCP meeting today,
Right,
correct?
right.
What's on the agenda, or what are we seeing, or what will be discussed?
So it's at 4 p.m. tonight, and they're going to continue discussions on the phase 1B prioritization. Phase 1B, so we started, right now we're having the phase 1B for the 75-year-old and older population. But phase 1B also covers the frontline critical, infrastructure workers. So they're going to continue discussions on prioritizing the rest of phase 1B. That and also any other new developments that may have arisen since they last met, because a lot has happened, right, since December 21st. So, we did receive the Moderna vaccines. There's a lot of other things that have come up since. So I'm sure that that's also something that.
What about requests to be vaccinated by? I know GPD has been requesting, as well as local and federal, the courts.
I'm sure that that's also something they'll be discussing, because I believe GPD does fall within the phase 1B category, because they are considered frontline essential workers. So I'm sure that that's something they'll be discussing, because, within the phase 1B category alone, I believe there are over 5,000 people that fall under that category, and we really don't have enough of the vaccines to distribute. And that number is really just a partial figure, because we don't have the full listing of how many employees or people who fall within that category. And I think that is a figure within the government of Guam. We don't have the full figure within the private sector also, because phase 1B also covers some private sector employees.
Okay. All right. And then as far as the clinic, going back to this, 9 to 3, and then Monday, Tuesday, Wednesday.
That's correct. Monday,
Right.
Tuesday, Wednesday.
Okay. Okay. Anything else you'd like to add?
We just want to urge the Manunkas of 75 years and older to please register with their respective village mayors. We do see people coming in who are not registered, but we want to make sure that we do give a fair distribution of the vaccines, and we do have close to registered. We want to make sure those who did register receive the vaccine, and it's a limited supply. So we just urge them to continue to register with their because it is a limited supply, and we want to make sure that they receive the vaccine. So just urging them to please register.
Okay. Okay. And then Thursday, community testing in Keeson?
Yes. We're still finalizing the details. I'm not sure yet exactly the location, but we will announce it hopefully by today where the location will be at what time. But Thursday is the anticipated date. Either 8 to 12 or 9 to 12. But yes, Thursday we do plan on having another community testing.
Okay. All right. Well, thank you, Janella. Thank you so much.
Do you plan on coming inside to do more?
Yeah. Okay. Yeah. Okay. All right. Thank you. I'm gonna head in and grab some more video for
Okay.
so we can have.
All right.
And then as Janella had mentioned, she cannot stress enough to register with your village mayors in order to receive the vaccine for the Manamco.
All right. Thanks a lot, Adriana.
Thank you.
Thanks, Janella. Adriana Cotero live from Ukadu High School, where Public Health has started their vaccination clinics. They've now moved into phase 1B of their vaccine distribution plan, and that is for our island's Manamco, 75 years of age or older. Just to give you an idea where we are, in phase 1A, they just completed that priority group. So from December 17th through the 24th, a total of 2,158 people have joined the vaccination or have been vaccinated. At Ukadu High School, 1,194 people were vaccinated there. GMH, 561. GRMC, 326. St. Dominic's, 67 people have been vaccinated there. That includes their workers. Over at the senior care home, the Capuchin Friary, 5 people, and at Notre Dame, I think that's the convent, 5 people have been vaccinated there. Again, the total for phase 1A between December 17th through the 24th, a total of 2,158 people have been vaccinated. Public Health is now moved into phase 1B. Again, that is for 75 years of age or older. If you plan on getting vaccinated and you're in this particular category, you need to register with your village mayor before you even think about going down there. Because if you do and you're not on the list, they will turn you away. That has been made explicitly clear by Public Health when Art Sinagatsin came on last week, along with Annette Uggan. You have to register with your village mayor. Also, some pre-screening eligibility that Public Health has mentioned, that you must not currently be infected with COVID-19 or previously infected within the last 14 days. You must never have taken other COVID-19 vaccine products, and you must not have received any other vaccine, such as the flu shot, in the last 14 days. In the last 14 days. Also, if you are on the list, you did register, you followed all the protocols, make sure you eat before you go, you hydrate before you go, and take your medications before you go. They are asking that you bring a list of the medications that you're taking. There will be doctors on site to do, pre-screening and also to monitor our Manamco that take the vaccine. Again, the vaccination clinic is today, Tuesday, and Wednesday from 9 a.m. to 1 o'clock, or is it 3 o'clock? 3 o'clock in the afternoon over at Ukadu High School. Again, register with your village mayors. That is going to do it for us here on The Link. Thank you so much, everybody, for watching.